Hello everyone, welcome to AlifMed Insurance Management. This is Tessie again here with you. In today's class, I'll be discussing on chapter 2, that is Neoplasm. In this particular chapter, we will come across the different coding guidelines when we are going to treat the patient with malignancy or neoplasm, and in a common term we can call it as cancer. So we will move on to different slides and different topics under this particular topic, that is a neoplasm. Today we are going to discuss under this neoplasm, about 10 points, that is the treatment directed towards a malignancy, that is a primary malignancy. If the treatment is directed towards a secondary site, if it's related to any complications, how we will code. Then if the malignancy is already excised and now the patient has come to the hospital for any other care, then what we are going to do. If the encounter is related to some complications involving chemotherapy, or to determine the extent of malignancy. And in the 7th point, we are going to discuss if malignancy is there in many stages, then malignant neoplasm without any specific site. Then the 9th point is current malignancy versus the personal history of malignancy. And the 10th one is malignant neoplasm associated with organ transplant. So in all these cases, we will be discussing on different 10 topics. In all these cases, what we are going to do, what are the different coding guidelines, what we should follow while coding these particular topics. First one is treatment directed at malignancy. For example, if a patient came to the hospital with an ovarian cyst or an ovarian cancer, and the doctor is directly going to do treatment for the ovarian cancer, so we have to designate ovarian cancer as a principal diagnosis. So in this particular case, ovarian cancer or the ovarian malignancy will be the principal diagnosis. So we should always note that if we are going to treat directly the primary malignancy, it should be the principal diagnosis. Point number 2, treatment of secondary site. That is, if the patient already had the ovarian cancer, it was treated, okay, and then the metastasis happened and it is directed to a secondary site. That is, maybe it spread to the uterus also. And now the patient has consulted a doctor for the treatment of the secondary site, that is for the uterine cancer only. Before it was ovarian cancer and now it is the uterine cancer. So the ovarian cancer is already treated and now the patient has come for uterine cancer. So the principal diagnosis should be the secondary neoplasm, that is the ovarian cancer is a principal diagnosis. Third point. In the third point, we will be discussing on coding and sequencing of the complications. Whenever we have patients with complications arising due to malignancy or cancer, there are different types of complications that is arising due to the cancer. So we will be coming across different complications and how we are going to code each complications and the different types. So we can check, like, there are 4 complications mainly, and for this 4 complications, how we are going to code, what will be the principal and what will be the secondary. So we have to be very careful in coding complications. First one is anemia associated with malignancy. If the patient has come to the hospital with anemia due to malignancy, the patient have any bone marrow cancer or leukemia, and because of this, if the complication arises as anemia, then the malignancy is sequenced as a principal diagnosis and followed by the appropriate code of anemia. So malignancy will be the principal code followed by anemia. So remember that in case of anemia, malignancy will be the principal diagnosis. We should not code, usually for other cases, we are coding complication as principal diagnosis, but in anemia, malignancy will be the principal diagnosis. Then anemia associated with chemotherapy, immunotherapy and radiation therapy. patient has undergone different types of therapy because she or he is suffering from cancer. As a part of the treatment, when they have undergone this particular type of therapies, the treatment is anemia. The treatment is done for anemia. Then we have to code anemia as a principal diagnosis, followed by appropriate code of neoplasm. So in this particular case, we have to code anemia as the principal diagnosis, followed by neoplasm as secondary. This is only in case of therapies. Then the third one is management of dehydration due to malignancy. As we all know, there are many treatments going on in the patient's body when there is malignancy, and because of that, there is a very higher chance for the patient to get dehydrated. So in this particular case, when dehydration is there for the patient, we have to code dehydration as a principal code, followed by malignancy. So this is same like the anemia related to the chemotherapy and immunotherapy and all. In this particular case also, we will code the complication, that is dehydration as a principal diagnosis, followed by malignancy. Then treatment of complication resulting from a surgical procedure. That is, there was a particular cancer that, again, I will come to the uterine or the ovarian cancer. There was a cancer. The uterine removal was done for the patient. And because of that, there is some complications like a bleeding or lower abdominal pain or back pain for the patient. So that is a complication that has happened because of the surgical procedure. So we will designate the complication as a principal diagnosis, followed by the treatment and surgical procedure. Then we will move on to the fifth point in malignancy, that is a primary malignancy previously excised. If there are, in this particular case, that is previously excised malignancy, there are two types of scenarios that is happening. The first one is that if no further treatment directed to that site, that is, there was a cancer, it is already removed by surgical excision, and now the patient is perfectly all right. He or she does not require any any medical treatment related to this particular malignancy. So in this case, we will put the primary malignancy. We will not put any primary malignancy code as a principal diagnosis. We will just use Z85, that is a personal history of malignant neoplasm should be indicated. That is, we should make our insurance company know that this particular patient was having a breast cancer or an ovarian cancer or a lung cancer or whatever it is. We will make the payer aware that this particular patient has a history of this particular malignant neoplasm. And in the second scenario, any mention of extension, invasion or metastasis, that is, if there is any extension, that is where there was a bronchial cancer and then it was metastasized and it is being transferred, and now the patient is having a lung cancer or a kidney cancer or whatever it is. So in this particular case, we have to list the Z85 code as a secondary code. The first principal code will be the secondary malignant neoplasm site, and then the secondary code should be Z85, that is a previous malignancy. Then admissions or encounters involving chemotherapy. In case of chemotherapy, when the patient is admitted, if the patient has come just for the administration of therapies like the chemotherapy, radiation or immunotherapy, we have to assign Z51, encounter for anti-neoplasm radiation therapy, or Z51.1, that is neoplasm or immunotherapy or whatever therapy we are going to do for the patient. This Z51 codes we have to assign as a principal diagnosis, followed by what type of neoplasm the patient is having. Then if the patient is admitted for the radiation chemotherapy and develops any complications, that is during the time of the patient came to the hospital for chemotherapy or radiation or whatever it is, any type of therapies, and now the patient is having any complications. So we have to code the therapy as a principal diagnosis, followed by the complications as a secondary diagnosis. So before we told, if a complication arises, okay, and then the patient has been admitted due to the complication, then we are going to assign complication as the principal diagnosis, and then the type of malignancy as a secondary diagnosis. In this particular case, when the patient has come for any particular therapy, and because of the therapy, if any complication arises, code therapy as a principal diagnosis, followed by the complication as a secondary diagnosis. Then admissions are encountered to determine extent of malignancy. That is, there was like any procedure, there was any type of malignancy for the patient, and now we are doing any procedure like thoracenthesis or paracenthesis to determine whether the primary malignancy is still there, or it is like it has been transferred to any other particular site or something like that. Whether we have to determine the extent of malignancy, up to which site the malignant cells are there, or what is the stage of malignancy for the patient, then we have to, like if it is already like metastatic and it's been spreaded to different parts, then we have to put the metastatic site should be designated as a principal diagnosis, and then we have to put the secondary as a chemotherapy, then the type of neoplasm, everything. Then malignancy in 2 or more non-contagious sites. As we know that there are different types of cancers, and in one part itself, like the cancer can spread in different grades. That is, if in the uterus, like in the lower end, if the patient is having this particular cancer, and then it has been developed, and then the patient, it's already metastasized to a different part, that is in the same part, in the same organ itself, in the different part. If it is metastatic, then what we have to do is that we can assign any particular place and any malignancy as a primary diagnosis, irrespective of the site. We can choose any one of the part as a principal diagnosis and the other one as a secondary diagnosis. There is no such rule that this should be primary or secondary. Then the 9th one is malignant neoplasm without specification of site. If a specific site is not mentioned, that is, if it's written like CA abdomen. So CA abdomen means there are different parts in the abdomen, the stomach, the intestine, the small intestine, the large intestine. There are many parts. So we don't know exactly which particular part it is. Or sometimes it's being given malignant patient, but the provider or the doctor has not mentioned what type of cancer or where is the cancer situated for that particular patient. So in this case, we can use C80.1, that is malignant neoplasm unspecified, that is this particular cancer is not specified. Then current malignancy versus personal history of malignancy. There are 2 scenarios in this particular case also. That is, when a primary malignancy has been excised, but further treatment such as additional surgery for malignancy or radiation or chemotherapy is being used for that particular patient or that particular site for the patient, then we have to code primary malignancy as the principal diagnosis until the treatment is completed. Then this is for the first case, that is, there was a primary malignancy, even if it is like it's okay, it's like degrading and the patient is coming to a normal stage, but still if we are doing any kind of treatment for this particular malignancy, then we have to code that primary malignancy as a principal diagnosis. In the second scenario, if the primary malignancy is already excised and no further treatment, that is a surgical or medical, no further treatment is directed to that particular site, and there is no evidence of an existing primary malignancy, then we can use Z85, personal history of malignant neoplasm, specifying that particular site. We can use it as the principal diagnosis. So this is the differences between the two types. Then malignant neoplasm associated with transplanted organ. There is a malignant neoplasm of a transplanted organ. That is, if the organ is if there is malignant neoplasm of the kidney, it's already transplanted, then we have to associate this particular case, and then in this case we have to assign the proper or the appropriate code for and if any complication arises, in this case we have to assign the complication of the transplanted organ or tissue as a principal diagnosis, followed by the malignant neoplasm, that is the malignant neoplasm of kidney associated with transplanted organ, that C80 series of codes are there. This should be used as an additional code. So if any complication arises due to the transplantation of the organ which is already affected with malignancy, what we are going to do is that we have to assign the principal diagnosis, that is T86, complication of transplanted organs and tissues. This should be assigned as a principal diagnosis, and the malignant neoplasm associated with the transplanted organ, that is a C80 series of codes, should be used as the secondary diagnosis. So these are the different types of coding guidelines in chapter 2, that is in the neoplasm. In our coding books, we can see the neoplasm table. We can assign the codes from the neoplasm table also. While we are coding the complications, especially about anemia due to during the therapies, and then the dehydration, the other types of complications, then the procedures that is being done during the time of malignancy, then the transplanted organs and its complications. So all these things, we should be very careful about all these things, and while assigning the codes, as a coder we should be doing a very effective and healthy coding. I hope this video was very informative for you to understand more about the neoplasm and its type of guidelines and the different coding system. So keep watching us. We will be coming up with more videos, and if anyone who has watched this particular video has not subscribed our channel, please subscribe and press the bell icon so that you will get more notification about the videos that we are going to post. So if you have any doubts or any comments, please paste it in the comment box so that I'll be giving up the answers for the questions whatever you have, or I'll be clearing the doubts whatever you have. Thank you once again. Have a nice day.